Hello, my name is Mary Williams, and today I will do my persuasive speech on mental health in our community. When we imagine someone with mental illness, we oftentimes frown upon them or have typical stereotypes that affect the people who are in this community with mental illness. That also deters them from wanting to get help. Has anyone in the audience has experienced someone in a mental health crisis, has a family member with mental health, has been diagnosed with mental health, or has a very close friend who has mental health illness? Short-term funding will help many communities and schools hire mental health professionals, develop programs, psychologists, and policy to advocate for those who have this mental health illness to make permanent solutions. That's according to the American Psychological Association. Mental health is affecting our community in a much larger rate than we know of. It is also affecting our youth with school shootings. Making this issue relevant allows us to break the cycles of stereotypes and get others who are suffering from this illness treatment and improve the relationships in society as a whole. 1 in 10 people experience serious mental health illnesses. 1 in 6 ages 12 to 17 expressed major depressive episodes, and it was a much larger percentage after the pandemic. Globally, 70% of people has had some sort of mental health crisis or mental illness and has received no treatment. Why is this? I have experiences with mental health community. I am a certified crisis intervention officer. I have been in the crisis intervention department for 2 years with North Carolina Department of Public Safety. I have dealt with offenders in the prison system who has committed crimes and have been diagnosed with mental health. We dealt with mental health illnesses on levels 1 through 3 in North Carolina Department of Public Safety. I am also a role player for Trillium Health, who also deals with mental health illnesses, and we do events where we have training, a 1-week training where you get certified, and we play role players and give out information on how you can deal or come up with different solutions with mental health crises. Today I will explain how mental health has become a problem in our community, how NAMI, the National Alliance for Mental Health and Mental Illness, is working to advocate for those who suffer from mental illness. What could happen if those who are suffering don't get help in our community? Having a good mental health state works heavily on the quality of life you sustain. Mental health is just your physical health. It's not just your physical health. It's mentally, but that also needs to be considered once you're taking care of yourself. Having a sense of being a part of a community and being able to connect with others, especially in the time of crisis, gives you a feeling of being accepted. Everyone is affected when it comes to mental illness, especially when a person goes through crisis and it hits our community. We must support and listen to those who are showing warning signs and act upon them once we notice them. Who will be there to listen when that person feels that they are about to break? The National Alliance on Mental Illness has a vision to have the world where people are affected by mental illness are healthy, fulfilling, supported by the community that cares. NAMI works to advocate, support, educate, and listen to those who are suffering with mental illness and their loved ones, according to NAMI.org. In October, NAMI hosted a mental health awareness walk and fundraisers to advocate for those communities in 120 different locations, and that was in October 1990. Congress helped with efforts to raise mental health awareness since then, And that mental health awareness walk we have joined in NAMI to educate the public with mental illness. Unaddressed mental health problems has a negative influence on homelessness, poverty, employment, safety, and the economy. It could impact the ability of our youth to be successful in school and the community free of disruption. Not acting on those who suffer can lead to an overall poor quality of life, including substance abuse, which leads to crime. If we don't act on this, this is how our community will end up. We can all be a part of this organization to advocate for change. Today I spoke on how mental illness affects a person's quality of life, how NAMI, the National Alliance of Mental Illness, educates and advocates for those who suffer with mental illness, and what we can do as a community to help those suffering lead a fulfilling life. Thank you.